Blood. Blood. Full blood count. In the investigation of blood diseases, the simplest test is a full blood count, FBC. A full blood count measures the following in a sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes, the volume of the cells, the erythrocyte sedimentation rate, ESR, a measurement or how quickly red blood cells fall to the bottom of a sample of blood. Anemia. Anemia. Anemia is one of the commonest diseases of the blood. It may be due to bleeding, loss of blood, excessive destruction of red cells, low production, for example, because the diet is lacking or deficient in iron, Fe. Professor, what the most likely diagnosis in this case? Student, most probably carcinoma of the bowel with chronic blood loss. What's agents that as a diagnosis? Student, well, he hasn't had any change in his bowel habit or lost weight. Pref Professor, what what else would you include in the differential diagnosis? Observe anemia in a man of this age. Student, he might have leukemia of some sort or aplastic anemia, but that's rare. It would be very unusual. unusual. Another cause is iron deficiency, but he seems to have an adequate diet. Professor. Okay, now there another cause of anemia, which I think is more likely. Student. Chronic bleeding also. Professor. Yes, that's right. But what about pernicious anemia? Can you exclude that? Student? Well, he's got none of the typical neurologic neurological neurological symptoms like paresthesia. paresthesia. Pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language notes in his textbook. Pernicious anemia (PA) is a condition in which there is atrophy of the gastric mucosa, with consequent failure of intrinsic factor production and vitamin B12 malabsorption. The onset is insidious with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red short-term glossitis is sometimes present. Patient pressed with symmetrical paresthesia in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable. Onset, beginning, insidious, slowly developing, pallor, lack of color, mild, slight, jaundice, bilirubemia. Breakdown, division into small parts. Bone marrow, soft tissue in the cavity of bone. Symmetrical, each side the same. Vibration sense, ability to feel vibration. Progressive, continuing to develop. Palpable, can be felt with the hands. Find words in the box with opposite meaning. Look at B and C opposite to help you. Adequate, adequate, inadequate. For, against, insidious, sudden, likely, unlikely. Severe, mild, rare, common. Make word combination using a word from each box. Look at B and C opposite to help you. Bone marrow, differential diagnosis, sense vibration, insidious onset, iron deficiency, pernicious anemia, progressively increasing. Complete sentences. Look at A, B, and C opposite to help you. 39 years old man presenting with a history of progressively abdominal distension over a period of 6 months. Blindness may be caused by vitamin A deficiency. Deep bleeding and purpura are caused by abnormal platelet function. The white cell count is normal, so we can exclude acute leukemia. The yellow color of her skin and conjunctiva is probably due to jaundice. There was a palpable mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balance with adequate intravenous fluid. The anemia may be due to increased red cell breakdown. Complete the conversation. Look at the opposite to help you. Professor, what is agent the diagnosis of pernicious anemia of physical examination? Student, the problem started quite suddenly, so it didn't have the typical insidious onset. He doesn't have any skin pallor, and he doesn't have symmetrical par paresthesia or absent vibration sense, and I couldn't his spleen pressure. What about his tongue? Student. His tongue was normal and not inflamed or sore. Over to you. List the causes of anemia mentioned in the conversation in the opposite. The shoes, the shoes, another condition that you encounter regularly and make a similar list of the causes in English. Use the index to help you. Causes of anemia: bleeding, iron, the deficiency, leukemia, chronic ulcer. Another condition, diabetes, causes, obesity, poor diet, lack of exercise. Now, in Spanish, sangre, hemograma completo. En la investigación de enfermedades de la sangre, la prueba más sencilla es un hemograma completo, HS. Un hemograma completo mide lo siguiente en una muestra de sangre: la cantidad de hemoglobina, el número de las diferentes células, glóbulos rojos, eritrocitos, glóbulos blancos, leucocitos y plaquetas, trombocitos, el volumen de las células, La velocidad de sedimentación globular, una medida de rapidez con que los glóbulos rojos se depositan en el fondo de una muestra de sangre. Anemia. La anemia es una de las enfermedades de la sangre más comunes. Pueden deberse a hemorragia, pérdida de sangre, destrucción excesiva de glóbulos rojos, baja producción, por ejemplo, porque la dieta carece de hierro. Una estudiante de medicina ha examinado a una paciente anciana con un nivel muy bajo de hemoglobina y está discutiendo el caso con su profesor. Profesor, ¿cuál es el diagnóstico más probable en este caso? Estudiante, lo más probable es que sea un carcinoma de intestino con pérdida crónica de sangre. Estudiante, lo más probable es que sea un carcinoma. Profesor, ¿qué impide ese diagnóstico? Estudiante, bueno, no ha tenido ningún cambio en sus hábitos intestinales, ni ha perdido peso. Profesor, ¿qué más incluiría en el diagnóstico diferencial de anemia grave en un hombre de esta edad? Estudiante, podría tener algún tipo de leucemia o anemia aplásica, pero eso es raro, sería muy inusual. Otra causa es la deficiencia de hierro, pero parece tener una dieta adecuada. Profesor, de acuerdo. Ahora bien, hay otra causa de anemia que creo que es más probable. Estudiante, úlcera sangrante crónica. Profesor, sí, correcto, pero ¿qué hay de la anemia perniciosa? ¿Puede descartarla, estudiante? Bueno, no tiene ninguno de los síntomas neurologísticos típicos como parestesias. Anemia perniciosa. Jordi Pons, el estudiante de medicina de Barcelona, ha hecho algunas notas lingüísticas en su libro de texto. La anemia perniciosa es una afección en la que hay atrofia de la mucosa gástrica, con la consiguiente insuficiencia de la producción del factor intrínseco y mala absorción de vitamina B12. El inicio es insidioso, con síntomas de anemia que aumentan progresivamente. A veces se dice que los pacientes tienen un color amarillo limón debido a una combinación de palidez e ictericia. Leve causada por la descomposición excesiva de la hemoglobina debido a la producción ineficaz de glóbulos rojos en la médula ósea. A veces se presenta una lengua roja y dolorida, glossitis. Los pacientes presentan parestesias simétricas en los dedos de las manos y los pies, pérdida temprana de la sensibilidad vibratoria y debilidad y ataxia progresiva. El vaso puede ser palpable. Inicio inicial, insidioso de desarrollo lento, palidez de color leve, palidez de color leve, ictericia, bilirrubinemia, descomposición, división en partes pequeñas, pequeña médula, ósea de tejido blando en la cavidad de los huesos, sensibilidad, simétrica a cada lado, vibratoria, capacidad de sentir vibraciones, progresivo, continúa desarrollándose, palpable, se puede sentir con la mano. Thank you for watching.